because I think, somebody listening today, or as this gets replayed, hopefully we can spare them a heart attack by what I'm going to present to you. So in the 1600s, an English physician known as the English Hippocrates, Thomas Sydenham, very well-known doctor, said, a man, and now we got to make it PC, a person is as old as his arteries, or I like to be positive, a person is as young as their arteries, but the ability to identify the age of your arteries, which can be tough because they're internal, and none of us sitting here right now probably can, unless you're very mindful, can be aware of what your arteries are doing and what your age is a key marker more than we ever knew, of your overall health. If your arteries are aging prematurely, your whole body's aging. That's new science in the last year. Old arteries are more likely to make kidney disease, dementia, cancer, as well as heart disease. And we lose people. The bottom right is Blake Kerkorian. Blake Kerkorian made about $500 million in IT companies out in LA before he hit 50, but about 6 weeks ago, walking back from surfing in the ocean, was walking to his car and dropped dead of a massive heart attack. It was in the news. He was well known. His companies were very well known. Obviously, Gary Shandling in the lower left, and the man with the nice smile and the white hair in the middle left was CEO of McDonald's, James Cantalupo, and Tim Russert. I mean, these are real people that are, that have access to the best medical care, yet they drop dead of heart disease. How can that happen? And it's just more likely to happen for those that maybe don't have such access. This is Oscar Munoz. Oscar Munoz took over in July as the new CEO of United Airlines last year. And within 6 weeks of starting the job, he suffered a massive heart attack at age 55. And it's just, the question is, how can somebody in that prominent position, we can talk about Bill Clinton. How did Bill Clinton not know he had 4 arteries severely blocked as the former president of the United States and all the care he got? Munoz's heart attack was so bad that he ended up having a heart transplant in January. As you can see, I wrote a blog about it. Can we have plants, not transplants? I was hoping that maybe I could reach him and get United Airlines to grab onto some serious lifestyle measures, and maybe it will. He's actually back to work. He's a modern miracle, but what if a 55-year-old man didn't have to suffer a heart attack, or knew years before that the problem was brewing? So we've talked about heart disease, diabetes, cancer. I haven't said these exact statistics, but the current science says they are largely preventable with lifestyle changes. P of preventable, this is what I call my PDR, preventable, detectable, and reversible. How do you prevent heart disease? Science, if you look at very small print, this is studies that involve about 40,000 people in Europe who were asked 25 years ago, do you have heart disease, and what are your lifestyle habits? And the answer was, I don't have heart disease, and they filled out what their lifestyle habits were. They were followed up 20, 25 years later. Those that remained free of heart attacks answered, I don't smoke, I walk, I eat all these fruits and vegetables every day, I sleep many hours a night peacefully, and I enjoy a few alcoholic beverages a week. That one actually consistently goes on the list of preventing heart attack and extending life, whether you want to incorporate that in your life or not, but that's a guilt-free little part of heart attack proof lifestyle. 85% reduction in heart attacks in those that say, I do 5 of 5. Now, typically, the number of people that do 5 of 5 is like 3%, because it's the fruit and vegetable one that is the least. In the United States, there's like 2% of Americans or less eat more than 5 servings of fruit and vegetables a day. So we got a long way to go. But this is what I want to focus on. That was prevention, lifestyle prevention, detection. How can it be that Winston Churchill, overweight, cigar in his hand, lives till 90-something, 91, and Jim Fixx, if anybody remembers the Book of Running in the 70s, thin guy, well-known runner, drops dead at age 53, and on autopsy he had horrible advanced heart disease without symptoms. Now, he was known to be a terrible eater. He was famous for saying, I can eat whatever I want because I run 10, 15 miles a day. But how can these people, how can we do better than just wait for that day? And indeed, there are tools that allow us right now, in fact, for at least the last 5 years, but certainly in 2016, to be heart attack prevention specialists. The one I want you to know about, whether you're watching live in the audience or on replay, is a CAT scan of the heart called a coronary artery calcium scan. Coronary artery calcium scan. There is calcium in your bones. There's never calcium in the heart, detectable on an x-ray. The heart is made of blood, fat, and muscle. Calcium is a hard white material on x-ray. It's never in the heart. So you have a panel A on the left, B in the middle, and C on the right. There is now a test that takes less than a minute. You lie down, you roll in a CAT scanner, you have no IV, nothing's injected, you hold your breath and you go home. Whatever your heart rate is, whatever your medicines are, it doesn't matter. And in those 20 seconds, you get an image of the heart arteries without having to inject dye. You don't want to see any white dots over your arteries, and you can be a calcium score of 0, which predicts an incredibly low-risk situation for 5-10 years or more. You can be the middle panel with a few white dots, meaning the arteries have plaque. You didn't know it, but now you learned it. And you can be the horrible situation on the right where you're walking around with literally arteries that are 10, 20, 30 years older and be playing tennis and be traveling the world and have no clue, but you're at extremely high risk of bad stuff happening. Now, the good news is you can also work on it if you find it. These tests have been around for more than 15 years. They used to be very expensive. In my community, it's about $100 to have this CAT scan. It's not insurance covered in Michigan. It is in Texas and a couple other states. Coronary artery calcium scan. How important is it? If you look at the yellow line, that's 10 to 12 years follow-up of people who had a coronary artery calcium score of 0. The good news, the panel that was on your left, panel A, and they're almost completely free of suffering a cardiac event like a heart attack or death. If you're the red line, your calcium score, because there's a number that can be calculated, if you've got heavy calcium and that score is over 400, you can see there's about a 25% chance over the next 10 to 12 years you're going to have a heart attack or possibly die. Would you like to know that? My argument is, if you read about what happened to Gary Shandling, he wasn't feeling good for 12 or 18 hours, called his friend who was a doctor, he was told stay home. If you knew your calcium score was 600 or 700 and you weren't feeling good, would you hightail it to the emergency room, maybe save a life? Let alone the idea that it might help you get motivated and learn how to reverse the process. No. So I'm a big advocate. If you know you have heart disease, if you've had a stent, a bypass, you definitely had a real heart attack, you don't need this test. This is for the other 95% that assume they're okay because they've seen their doctor, maybe even had a stress test, because you can pass a stress test and still have quite significant coronary artery calcification. And you probably need to do it once for $100 when you're 45 or 50. You can do it a little younger if you have diabetes or a bad cholesterol or smoking. You can do it when you're older too. So what do you do about it? Well, that's the last part. PDR, R is reversible, prevent, detect, and reverse. We've talked about Morrison and Ornish and Esselstyn and Pritikin, and they're all incredibly powerful lifestyle-based. But I will tell you there are some, I'll be just tease you with it and I'll show you. These are examples of people that had very high coronary artery calcium scores. There's a coronary artery calcium score of 2,032 that within 6 months had dropped in half using certain nutritional and vitamin and supplement-based treatments. There are ways even beyond diet to really push the envelope. And these are the kind of things I do in my clinic in Detroit, is I use plant-based diets based on all the teaching of all these heroes, but go beyond that. Infrared sauna can be part of that program, something that's used at Hippocrates Health very aggressively. There's a vitamin out there called vitamin K2 that's involved in calcification of arteries. In a large study that's shown here in the graph, the higher your blood level of vitamin K2, the lower was the amount of calcium in your aorta, and the lower was the risk of cardiac death during follow-up in this study. This just happened to be a blood test and follow-up. There's an ongoing study that's randomized vitamin K2 or placebo to really prove the point. But I'm just putting it out there. This is called the Rotterdam study, that there are therapies if you have one of those coronary calcium CT scans that can reverse it. This is another therapy called Nanobac that 58% of patients taking a certain vitamin had a drop in their calcium score within 4 months. Some of them dropped all the way back to 0, which is that great place to be. And finally, there's a word that still in traditional cardiology is illegal to say at a conference, chelation. Chelation is a kind of therapy where it was usually intravenous, where there were chemicals that were believed to remove plaque from arteries, remove what are called heavy metals like mercury and lead from arteries, largely abandoned by the standard medical community due to a lack of data and probably should have been abandoned due to lack of data until 2012, when this large government-funded study called the TAC trial was published. If you look at the lower green line, that's a combination of chelation and high-dose vitamins given to almost 1,800 heart patients followed for 5 years, compared to, if you go to the very top, one of those blue lines, that was looking at the outcome of developing problems. There was a huge difference. If you were a diabetic who had had heart disease and you got chelation and vitamins, you had a huge advantage over getting placebo. So when the TAC trial was announced by the University of Miami, and they said chelation seems to have a power to stabilize the cardiac status of diabetics with heart disease, there was no angiograms performed, so we can't actually say it reversed their disease. It just improved the chance they were going to have a heart attack, end up in the hospital, or die. It should have had a ripple effect throughout the country. We should have had chelation centers developing, or at least a lot of discussion. But, standard medicine doesn't accept new ideas that aren't reimbursable, that aren't understood. This whole thing disappeared from public eye in about 2 or 3 weeks, until about 6 weeks ago, when the University of Miami announced they got another $30 million from the government, and they're embarking on what's called TAC 2, which will be a second phase of the study. I think it's going to nail it, that this is a very powerful alternative therapy of heart disease that can be incorporated with other therapies. Very novel and very exciting, actually. So I think I have just a couple last slides. How'd we go from 1984 thinking cholesterol was bad to 30 years later, celebrating butter? I just want to, again, go back to show you that diet matters. This was 302 men and women that had had a heart attack and had blocked arteries. They took their butter away, and you might say this is crazy. They took their saturated fat away. They put them on canola oil margarine, which was much lower in saturated fat, and we all cringe when we hear about vegetable oils and canola oil. But it actually dropped their risk of a heart event and death by 65% within just a very short time. The Lyon Heart Study is a very famous study. And this is what happened in, this is my own personal pet peeve, is this whole butter stuff. This is what happened in the country of Finland. In the late 60s, Finland had the highest heart attack rate in the world, and young people, 40-year-old strapping farmers in Finland, loggers in Finland, were dying like flies left and right. Literally, they had a heart attack rate higher than the United States by far. And the government got behind a project called the North Karelia Project to say, we've got to educate the public. Don't smoke, of course. Eat a fruit and vegetable, but give up butter. Do anything but eat butter. You can eat margarine or don't eat anything. Heart attack rates fell by 80% in 5 years in Finland with an education program that said decrease animal saturated fat, either substituted with vegetable polyunsaturated oils or nothing. 85% reduction in heart rate. So I make that point that if you're confused nowadays by all this stuff, you need to ask about, what about the Lyon Heart Trial? What about Finland? This is my last point. If I can't get you for heart disease, there's circles there. The penile artery is 1 millimeter. The heart arteries are 3 millimeters. And if you don't eat for your heart arteries, at least the guys should be eating for their 1 to 2 millimeter penile artery, meaning if you feel lucky enough and want to eat all this crap and buy into Time magazine that butter's back, just make sure you're feeling lucky, because I don't think it's going to work out very well for you in the long run. Thank you for recommending the whole food plant-based diet and reversing heart disease. Forks Over Knives, the China study as references. I've read all the books. It's been 2 weeks. I've never felt better. I lost 15 pounds, more energy. Although it's not my focus, I'm going to get off all my medications. These are kind of notes that patients will send you when you just open the door and let them, begin studying on their own what's available, what the data is, and they start to experience the benefits. I thank you very much. I think I'm right on time, and I appreciate your attention. Have a wonderful day.